In part 2 of the frozen shoulder series, we're going to talk about the 3 locations of frozen. With a frozen shoulder, you are always going to feel pain in the front of the shoulder because that's where a frozen shoulder starts, and you may or may not have pain in the side of the shoulder or the back of the shoulder. There are 4 phases of frozen shoulder. The first is the pre-freezing. That can last a few days to a week. It can be immediate in the case of trauma, but it can also be started with something as simple as reaching into the back seat of the car where you feel a twinge in the front of the shoulder that doesn't seem to get any better. And after a few days, the pain is constant and the decreased motion is remarkably present to you. Shockingly to you. You'll find that you just can't move your shoulder well at all, and it's at this point you typically become pretty concerned. The freezing phase lasts 1 to 8 months. It's the most painful stage. You can't get away from the pain. It follows you everywhere you go, and it's during this freezing phase that most relationships suffer the most, and jobs can be lost as well. During the frozen phase, that's 9 to 16 months, the pain diminishes quite a bit, but you still can't move your arm. During the thawing phase, which lasts 12 to 40 months, the pain is virtually gone, and you start to be able to move your shoulder again. Typically, a frozen shoulder will resolve, for the most part, in 1.5 to 3 years. With proper care, proper treatment, most frozen shoulders will resolve completely within 4 to 6 months. Left untreated, a frozen shoulder can still leave residual effects after 7 years. And in fact, that's true of 70% of the people who have a frozen shoulder. Many people can still have problems even after 10 years if they're untreated. One piece of advice I guess I would give you regarding a frozen shoulder is don't put it in a sling. Keep moving it. If you immobilize the shoulder with a sling, it will freeze even more. Dr. Stetson is an MD. He's an orthopedic surgeon. And he says that 50% of patients go on to surgery if they're only treated with physical therapy. Well, we use physical therapy on our patients, but we also use a number of other techniques as well. And there's a reason why our results are so good. 90% experience very good to excellent results, and we're very proud of that. There is a better way. And we're going to tell you a great deal more about that in the next few parts.